Welcome to The Remedy with Dr. Rani Whitfield, where music, medicine, literacy, and other hot topics meet. I'm your host, Dr. Rani, also known as the Pop Doc, and today, we're discussing an institution making groundbreaking strides in healthcare education. It is the Southern University School of Nursing, also known as SUSON. From addressing racial and gender disparities to creating an inclusive future, SUSON's impact cannot be overstated. But before we get into the topic, please don't forget to like this video, subscribe, and share. It helps us grow and gets these topics to the masses. Established in 1986, the Southern University School of Nursing in Baton Rouge, Louisiana, my hometown, is a significant part of the Southern University system, the only HBCU system in the country. It has evolved into a powerhouse of healthcare education. It actually offers 4 degree programs: the Bachelor of Science in Nursing, the 100% online RN to BSN program, the Master of Science in Nursing with a focus on family health, and the Doctor of Nursing Practice and PhD programs, both dedicated to leadership and research. SUSON isn't just about academics. It houses a state-of-the-art simulation center, a nurse-managed family healthcare clinic, and even a mobile health clinic called the JAG Mobile. This wheelchair-accessible clinic is equipped with telehealth technology, providing culturally sensitive healthcare to underserved communities. Over the years, SUSON has produced over 2,700 BSN graduates, my amazing wife being one of them, and is one of the largest producers of African-American nurses in the United States. This year, for the first time, SUSON ranked in the top 10% of best undergraduate nursing programs for 2025 by U.S. News and World Report. It is a testament to their commitment to excellence. But beyond accolades and statistics, SUSON is making a difference where it is needed most. I am the proud product of the Southern University and A&M College. Again, the only HBCU system in the world. I'm also a graduate of Meharry Medical College, one of the only 4 historically black medical schools in the country. As this channel grows, you will hear me discuss the critical shortage of black male doctors in the U.S., with only about 2 to 3% of practicing physicians identifying as black men. This lack of representation has far-reaching impacts on healthcare access, patient trust, and health outcomes within black communities. Research shows that black patients often receive more effective care when treated by black physicians, highlighting the need to increase diversity within the medical profession. Programs and mentorships aimed at supporting young black men in pursuing medical careers are essential steps in bridging this gap. SUSON is addressing racial and gender disparities in nursing. Despite having over 4 million registered nurses in the United States, only 11% are African American. The gender gap is equally stark, as male nurses make up only 12% of the workforce, with an even smaller fraction being African American. So why is this important? Because we need a culturally competent nursing workforce that reflects our diverse population. This is essential to achieving health equity. The race concordance hypothesis suggests that patients who share the same race or gender with their healthcare provider experience better communication, better trust, and better health outcomes. Unfortunately, the lack of African American male nurses limits these trust-building relationships. I'm often asked when discussing this topic, what barriers do African American men face in nursing? Historically, stereotypes have painted nursing as a female-only profession, and men, especially African American men, have faced systemic challenges. From having their competency questioned to feeling isolated in predominantly white or female environments, these barriers can be discouraging to young men. Yet SUSON, they're breaking through these obstacles. In a historic milestone, SUSON enrolled its largest cohort of African American male students in the BSN program, 33 men from across the United States. These students aren't just attending classes, they're leading the way in mentorship programs, student nursing associations, and advocacy groups. Their presence and leaderships are transforming the perception of what it means to be a nurse. Dean of Southern University College of Nursing, Dr. Sandra Brown, my friend, highlighted in a recent journal article the resilience and grit of SUSON students, many whom are first-generation college graduates. They are changing narratives and creating a pipeline for future healthcare professionals. One of our SUSON students captured the spirit perfectly by saying, "We're changing what Southern University is known for. If you want a great nursing education, SUSON is it." A viral social media video featuring the men of SUSON reached over 40 million people, shattering stereotypes and inspiring others to consider nursing as a career and attending the Southern University School of Nursing. Platforms like Instagram, TikTok, LinkedIn have amplified these stories, showcasing the impact of representation. On November 19th on my YouTube channel, we will be sharing a music video featuring the men of SUSON, a song written by myself, filmed at the nursing school by my good friend Dennis Films, and recorded and mixed by Mixmaster Sean Andrew. The song entitled SUSON Strong celebrates the achievement of these very talented young men. It's clear to me that SUSON is more than just a school. It's a movement. As one male student put it, seeing that black men can do other things besides play football or basketball or be considered always in prison, nursing is an option that they can have. It's about using their brains and compassion to make a lasting impact on their communities. What does this mean for the future of healthcare? By fostering diversity, SUSON is not only improving health outcomes, but also reshaping the profession to be more inclusive and representative. As future nurse leaders, these men will bring perspectives that help share a more equitable healthcare system. As I close, remember the impact of our decisions. You were born looking like your parents, but you will die looking like your decisions. SUSON Stories reminds us that the choices we make today can transform entire communities. Be sure to come back to the YouTube channel, 12 noon on November 19th. You got to watch the music video, SUSON Strong, featuring the young men of SUSON and your boy, the hip-hop guy, dropping a few
in the
balls.
history of our university.
On that day, we will also feed the entire nursing school. So ladies, we didn't forget about you. But we got to represent these men because they get very little attention. And we're just going to fellowship with one another and have a good time. I cannot wait to share this moment with these young students. So thank you all for tuning in to The Remedy with Dr. Rani Whitfield. Please remember to like, subscribe, and share the channel. It could save your life. It's the hip hop doc they call me H2D. Come on, y'all. Let's get hip hop healthy. Until next time, peace and blessings. I'm out.